Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, types of dumping syndrome. Dumping syndrome can be divided into two types. We have early dumping syndrome and then we have late dumping syndrome. Okay, so we should learn both of them in detail. So first, early dumping syndrome. In this class, late dumping syndrome in the next class. Early dumping syndrome occurs immediately after meals. That is, early dumping syndrome will occur around 15 to 30 minutes after meals. In early dumping syndrome, there is dumping of hyperosmolar contents occurs from the stomach into the small bowel. There will be dumping of hyperosmolar contents will occur, and because of this dumping of hyperosmolar contents from the stomach into the bowel, this will result in rapid fluid influx from the circulation into the GIT. So what does that mean? That is because here the osmolarity is increased. As a result, because of increased osmolarity, it sucks the fluid from the circulation into the gastrointestinal tract. So because of sucking of fluid from the circulation, that is from the blood vessels into the gastrointestinal tract, the patient will develop acute intestinal distension. Because of increased fluids in the intestine, there is acute intestinal distension with peripheral vasodilatation will occur, and this will give rise to some vasomotor and abdominal symptoms in a patient with early dumping syndrome. Now, what are the symptoms? Here the patient will present with epigastric fullness, sweating, lightheadedness, tachycardia, diarrhea are seen. Diarrhea is because of increased volume overload. Diarrhea is because of the contents will, because there is fluid which enters from the blood vessels into the small bowel, resulting in diarrhea. Similarly, because of the vasomotor symptoms, the patient develops sweating, lightheadedness, tachycardia and diarrhea. So how are you going to stop or treat these symptoms? These symptoms are mainly treated by lying down. These symptoms can be decreased or ameliorated by lying down, and they will, you can also give saline infusion to the patient also. Okay, but the main treatment is to take small diets, small fluid diets, that is multiple small meals is important for the um, early dumping syndrome.
thank you and thank you for watching.